So we've been asking people about their experiences of health and social care in England. And despite what the statistics tell us, actually people's experiences are very different. So the statistics say that people think that they get a great quality service, particularly from the NHS, and also that people are very satisfied with the treatment or care they receive. In reality, once you ask people in a bit more depth, they're a bit more honest about those experiences. So we talked to people who said, actually, I received pretty poor treatment, I experienced neglect, even serious mistakes and abuse. But because I'm so glad that the NHS is free, that I was able to get social care because, frankly, eligibility is so high, they were willing to explain away some of those very serious things. So they would say, you know, the doctor was just run off his feet, the nurse tried as well as she could, but there were only 2 of them on the ward. And that's really worrying for us, because the important thing about the future of health and social care is that people are properly engaged and that they can find ways of directing their own treatment and care, which mean that they can live independently and be as healthy for as long as possible, particularly important in an ageing population. One of the other big concerns that we had was that people told us that when something went wrong, they were unwilling to speak up. So half of the people we spoke to who had a problem in health and social care in the last 3 years did nothing. And half of those people said it was because they didn't believe anyone would take action. And that's why we've developed a new framework for health and social care, which is about the rights that people can expect if they're using these services. And it's really important because if you don't know what to expect from a system, particularly one that's going through such significant change, you don't know what you'll get. And therefore you can't challenge when you don't get the care and the high quality care that you deserve and need. So we're starting a conversation with the public so that they really understand what the new health and social care landscape looks like, but also so that we can capture for the first time what rights and entitlements should look like. Through that big conversation, we will then have a path which tells us where we are now and where we want to be in the future. And it will be down to HealthWatch England, local HealthWatch network, and our partners to make sure that we hold statutory players, including the government, to account to make sure that people get the best quality treatment and care that they need. QualityWatch is really exciting because it's a beginning of a new idea around how we think about quality in both health and social care. At the moment, quality is seen in a whole range of different ways in different health services across health and social care. This is about bringing it into one place so that we understand what best practice looks like. It's really important as part of that that we capture the lived experience of people using health and social care services, because so many times we just rely on those headline statistics about what quality means without understanding enough of what the experience looks like. And it's some of those softer things around people's experience of quality that really give us an insight into what's going wrong, but most importantly, what could improve for the future.